Welcome back. Well, we know about the importance of PPEs, personal protective equipment, especially for our heroes on the front line, the medical workers that need it most. But we also, talking about the use of masks, there's been much debate with regards to whether to use a mask. The conventional wisdom is that if you can use a mask if you don't have, if you can't maintain physical distance, social distancing, that's when you use the mask. Now we were told that we can also use cloth masks, homemade masks, so to speak. The experts tell us rather not use the N95 mask, which is really needed by our healthcare workers. So the cloth mask will keep you from spreading the virus if you have it. I want to talk to you about the Islamic Medical Association. They're spearheading a project to ensure that ordinary South Africans have access to this cloth mask. And I want to bring in now, via Skype, Dr. Fehmeeda Moosa to talk to us about the IMASA reusable face mask project. Doctor, pleasure having you on the program.
Thank you.
Talk to us about this project and how important is it?
Okay, so we know that wearing of the mask is actually what's recommended at the moment. So we embarked on a project to create a reusable, washable face mask that can be used by the general public so that we can reserve the PPE for where it's needed.
Okay, so walk us through this now, Doctor, in terms of the different types of masks and what the masks that you and your team are proposing. And how does one get access to this mask?
So we've begun the production of a 3-layered mask. I'm not sure if we can actually zoom in on the mask. This is what it looks like.
Lift it up a little higher. There we go. There we go. Talk to us through it now.
Okay. Okay. So basically, it's a 3-layer mask.
Right.
It has a front and a back, 2 different colors. So you can distinguish which side goes onto your face and which one is the back of the mask.
Okay.
We are using 100% cotton with violin as a filter in the center. And we are using these ties as they create a very snug fit on the face, and then it becomes one size fits all.
Okay, so does it matter what type of material you use?
From the reading that we've done, it is preferable that you use 100% cotton.
Right.
But that's what's recommended at the moment.
So the normal health protocols or protocols when using a mask, we are told is that when you're done with it, you throw it away. Not every mask can be reusable. Why is your mask reusable? What makes it reusable?
Okay, because it's made out of fabric, it's washable.
Right.
And that was the idea behind creating it, because it's also cost effective then.
Right.
You don't have to replace the mask every time you use it.
So we are watching some video now in terms of how you're making it. Just walk us through that process in terms of manufacturing these masks.
So once you have your fabric, you need 3 layers of fabric, 2 cotton and 1 violin.
Right.
And then the mask is just stitched together in the 3 layers. We've created pleats along the mask. And then we just put on some bias binding around and wash it, and it's ready for use.
So how durable is it, and how long would it last? Say, for instance, would it a month, 2 months, 3 months? How long would it last? What's your recommendation? Okay.
I'm hoping that, that's a difficult question, but I'm hoping that it's going to last for as long as it's needed, because it is made out of cotton, and it's like a garment that you would wear.
Yes, yes. And where are you distributing these masks?
So the idea behind making the mask was to actually distribute it among the non-medical essential workers and the inhabitants of the informal settlements. We have begun distribution. We've distributed at least 5,000 already. Right. Some have gone to the homeless shelters. We've partnered with an organization called Feed, who've identified the homeless, and we've actually started distributing there. Some of the hospitals have the masks, and they are giving it out to their patients. And just to make note that it's to the patients, not for the hospital workers.
Right.
And
Oh, doctor, do we still have you? Oh, it seems it's such a pity. We lost Dr. Fehmeeda Moosa. They're talking about this very important project, this mask project, and this is the reusable face mask project. I understand Dr. Fehmeeda Moosa is back on the line. Doc, just go back to your point. You were talking about the importance of it and how you make it and where you're distributing it to.
Yeah, we were talking about where it's distributed.
Yeah.
So most importantly, it's being distributed amongst the homeless shelters. We're distributing it to the informal settlements via hampers that have been going out to different organizations. We hope to produce many, many more. We have 20,000 production at the moment. And once those are produced, we will definitely get them out into the informal settlements.
So we are told to use cloth masks, the general public to use these cloth masks. Explain to the viewers why is it so important to use this mask as opposed to the N95 mask, for instance, which is so desperately needed by our medical staff, our medical personnel. Talk to us about the difference between this mask and that mask and why we should stick to this one.
Okay, so we need to reserve the N95s and the FFP2s and the medical masks, the medical fraternity, because these are workers that are on the front line and are facing really sick patients every day and are helping the rest of us to stay safe. So if we could at home, while going to the supermarket or going to to see your doctor or whatever, don the reusable face mask, you're saving the protective personal equipment for the health fraternity.
Right. Because, some of the experts are saying, try to behave like you have the virus already. Why? Because you want to protect others. So by using this mask, even if you have the virus and you don't know, you're asymptomatic, you don't spread the virus via these droplets, correct?
Yes, that's correct.
Yeah.
But remember, it's I protect you, you protect me.
Yeah, correct.
So by wearing a mask, if you are ill, it doesn't prevent you from, it prevents you from giving, doesn't prevent you from getting.
100%. Yeah, because, there's gaps and these virus particles are so small, it can get through those gaps, isn't it? It's more for you not spreading it.
Correct.
So,
correct. Absolutely.
Look, we have a huge population. We need as many masks as we can. How quick are you guys to make as much masks as possible? What's the capacity there?
Okay. If we have people that can assist and come on board, we can increase the capacity.
Yeah.
We're obviously limited by funds as we are, just an organization, an NGO. So if there are people that can assist, please, if they could contact IMASA, we could really then try and increase the production of these masks.
Very quickly, give us your contact details.
It's imasa.gauteng@gmail.com.
All right, imasa@gauteng.gmail.com. Doctor, thank you very much indeed.
@gmail.com.
All right, one more time. I think we broke up there. One more time, give it to us.
imasa.gauteng@gmail.com.
All right. We do appreciate your time there, Doctor, and all the work that you and your team are doing. Thank you very much indeed for coming on.
Thank you for giving us the opportunity.
All right. God bless. Thank you. That was Dr. Fehmeeda Moosa there from the IMASA Reusable Face Mask Project. If you can help, you heard the email address that you can. We'll try to put it up on our social media page if possible. So, that was IMASA Reusable Face Mask Project, and that was Dr. Fehmeeda Moosa. That quick break. I'll get you more news next. Stay with us.